Today we're going to be talking about a very important topic for many of you, not everybody, but for many of you, which is what should I do with mom and dad? Hello everyone, this is Dr. Chris Martinson here with your SARS-CoV-2. It's COVID-19, aka the honey badger virus, your daily update here for April 21st, 2020. This is day 89 of reporting. And for many of you, you're facing very, very difficult decisions about what to do with mom and dad, particularly if you've read any of the very distressing COVID cases that have been sweeping through many of the larger nursing home facilities. So if your mom, dad, and or dad are in a care facility, you're really going to want to pay attention to this one. And at Peak Prosperity, what we're all about is information that leads to action. Information without action, at best, is interesting. At worst, is distressing. So we're all about the action. If you're reading this, listening to this, following along, and you just find this distressing, it's probably because you're not taking actions. So let's talk about the actions you can take, and we'll have a very specific one here for you today. All right, looking at these numbers, guess what? Many of these are flattening out, are down from the days before, or just plain out and out flat, even though it looks pretty bad, right? 28,000 new cases. These are April 20th cases. Why? Because I record this at a time of day when today's dates numbers, which would be the 21st, are not complete. But still, this was way over 2,000 for a number of days. So deaths and cases are all coming down. We're seeing this pretty much across the board. Pretty much every one of these numbers is at or below where it was yesterday or the day before. And that's really good news. And it speaks to the fact that the social isolation, the distancing, the lockdowns, the very economically damaging things that have happened have been working to limit the spread of cases. And in fact, when we look at this over an entire world view here, this is total daily new cases. It's across the entire world. Here's China with that. Remember, they did that one day. They're like, oh, we forgot to count about 18,000 cases. And that was huge news at the time, but pales in comparison to what's happened. And I think we can see this clear topping process that's happened here. I'm not ready to say that's coming down because it came down here, looks kind of flat across that part right there. But for sure, efforts that the world have been taking to limit new cases has been working. And why is that important? Because great piece of summary reporting here out of the New York Times. Excess deaths looking at the historical average. These are weekly deaths here that we're seeing. This is for France. This is their historical average here. And then this is what they actually saw here. And remember, these are excess deaths. So this isn't just COVID deaths. This is comparing the historical average of all the deaths here, say in the Netherlands, would look like this across the sweep of the year. Here it is in Indonesia. Here it is in Turkey. Everything tracks along for a little while in January until you get out to about March or so, and then boom, this goes. Now, a little confusing because I'm not sure I don't know why, but this one doesn't track all the way out to December. But at any rate, I think you can see the clear pattern here, which is that there are many, many excess deaths. And of course, this is total deaths. So there are many people who are not dying because of COVID. People are not getting into car accidents because so many fewer miles are being driven. People aren't getting into boating accidents. They're not getting into airplane accidents. They're not doing all sorts of things that can lead to death outside of the home. So those are on the negative side of adding to new deaths. COVID is on the positive side of adding to new deaths. And as well, there are a lot of other new deaths that are showing up out there as well. Heart attacks, really a lot of troubling news about heart attacks really starting to show up. And is that because people aren't going to the hospital and because they're fearing COVID, or is it because COVID is causing more cardiac events at home? We don't know the answers to those yet, but you can clearly see many, many thousands of deaths per week now are showing up in excess of what you would consider normal. And that's why it's very important to flatten that curve. Because if this curve had kept going up like this, we would see these curves just continue to climb like this too. What this chart is telling us is that eventually we get to see this happen as well. And then eventually this will come back down again. And that's if you can manage to get these new cases all the way back down again. I'm not sure that's possible. I'm not sure it's even advisable. I'm not sure it's something we should really strive for because we're going to have to learn how to live with this virus. And part of that is there will be excess deaths for a period of time. And it's not possible to get these down to zero, new cases down to zero, without completely crushing the economy, which will lead to many, many more deaths beyond what we're already seeing from COVID. So that's the balancing act. We've been talking about that for a long time. So we're going to have to just face up to the fact that this is a whole new situation. We now have a virus among us. But every single case that they looked at here, we would see that there were many, many excess deaths compared to the historical average, including Sweden. And these, I think these come through maybe last week. So I'm not sure that they have the updated stuff that would take us through this week. All right, kind of interesting as well. The U.S. suspends immigration. Trump plans to suspend. Whoops, not that one. Let me get rid of that. Get my other pen. Trump plans to suspend immigration to U.S. The president portrayed the measure, his most wide-ranging attempt yet to seal off the country from the world, as a bid to save Americans' jobs amid the coronavirus pandemic. So President Trump said on Monday evening he intended to close the United States to people trying to immigrate into the country to live and work. That's a big move. A drastic move, he said, would protect American workers from foreign competition once the nation's economy began to recover. So this is being pitched as an economic thing, and here's how Trump put it. In light of the attack from the invisible enemy, that's an interesting way to put it, as well as the need to protect the jobs of our great American citizens, I will be signing an executive order to temporarily suspend immigration into the United States. Whoa. All right. Remember, he accidentally came across, I believe, step one of the gold standard pandemic approach. First thing is halt all those inbound infections. I'm not sure if this totally qualifies because this is just immigration. Obviously, this full first step here would involve actually stopping all sorts of travel. And that might include domestic interior travel. You might want to take plane flights and train routes from these hotspots and prevent them from going to non-hotspots, because you can both halting the inbound infections, not just at the national level, it could be at the community level or the city level or the state level. All right, 1B would be face masks for everyone. And again, the data coming out of the countries with face masks for everyone is just astonishing. It works. It really works. I don't know why we can't get there, but if maybe it's time to start a rumor, maybe we could nudge Trump. What would that rumor be? I know. How about if we said face masks if everybody wears them, it'll make the stock market go up. I think maybe we could get Trump to go on board with that, and then that would be great. An executive order. Face masks for everybody to make our great stock market go up again. That would be awesome. All right. I don't care how we get there. See, I'm agnostic. If we want to do this I don't care what the reasons are. I just want them done because then this will happen. All right. So, we keep hearing all this stuff, and I've been getting a lot of this. I understand this is getting long in the tooth, and some people are really worn down, and not everybody's really geared for a big marathon like this. So I get a lot of pushback and feedback from people saying, oh, you're pushing fear porn, Chris, or, why do you, 80% of the cases are mild. Why don't we just, it's not that bad. So I keep pushing at this because it is that bad. This is a very bad disease. And that's not fear porn. This is just the data. So here, if you go to reddit.com and their subreddit, that's what the /r means. They have COVID-19 positive, very interesting place where people are posting their tales of their personal anecdotal experiences with this. This is really important. So here we have a 28-year-old female who is in week 5 and got admitted to the hospital. So this would be now a serious case once they're admitted to the hospital. But look at the mild part of this, will you? I'm a 28-year-old female from the United States, no pre-existing health conditions, in shape, eat healthy, good BMI, etc. I was diagnosed with COVID positive on the 23rd of March. It's now the 21st of April, so we'll call that a month ago. Tomorrow will be an entire month. This is my 4th and perhaps worst wave of symptoms. After struggling on and off for weeks at home, I was admitted to the hospital. I was vomiting uncontrollably, running a 95.9 to 96.0 degree temp, which is too low, right? That's not a fever, which 98.6. Struggling to breathe on my own and had severe sweats and violent chills. Turns out my pulse oxygen was very low, which they helped with right away. They also ran another slew of tests. After my chest x-ray, EKG, and CT of the chest, the doctors came in to let me know that my pulmonary artery was extremely dilated. Doc said he usually sees this in people in their 70s and 80s. Why was that pulmonary artery extremely dilated because the other side of that artery, the interstitial space of all those alveoli sacs is all wrecked. And so the heart is pushing really, really hard to try and get blood out there because it wants to get more blood pumping out there, but the pipes are blocked. So to see a distended or dilated pulmonary artery, not surprising in this particular condition, based on those autopsy reports we reported, a week ago. They are unsure if the damage to my lungs from COVID has affected my heart and arteries. I'd say I'm pretty sure. They did notice that my lung function was back to normal, but some abnormal spots in my lungs perhaps left behind by COVID. So this is what would be called a mild case, all right? As well, now here from a recent article, so this is titled Permanently Damaged. The Innsbruck University Clinic has found lung damage in recovered COVID sufferers. The damage is apparently permanent. So this is something we've been talking about and I've been very concerned about. So these so-called mild cases that people recover from may be anything but mild and or recoverable from. It is now undisputed, the article reads here, that COVID-19 should be taken seriously as a serious illness. How the late effects will have an impact will only become clear step by step. Recovered patients in diving are also at particular risk. The massive changes in the lungs can significantly increase the risk of accidents, said the senior physician of the Innsbruck University Clinic, Frank Hartig. He heads the emergency department in the hospital and is the responsible crisis coordinator for COVID-19 patients. In the clinic, doctors have treated dozens of coronavirus sufferers in recent weeks, from symptom-free spreaders to intensive care patients on the heart and lung machine. Among them were 6 active divers, all of whom did not have to be treated in the hospital, but cured themselves in home quarantines. So these are mild cases. All of them were not severe cases. Their illnesses were 5 to 6 weeks ago, so pretty recovered, and they are considered to have recovered, but they no longer can dive. The damage to the lungs is irreversible, said Hartig in an interview with APA. All right. This is continuing it. Same article here. This is shocking. We don't understand what's going on here. They are probably lifelong patients, so it doesn't matter whether they dive again or not, said the doctor. The bad news was made clear by lung CTs. They didn't get any better at all in imaging, said Hartig. As an emergency doctor with 20 years of experience, you swallow when you see something like this in a 40-year-old patient. To what extent long-term effects remain on the lungs is unclear, according to the doctor, and is currently speculative. We don't know how much of the changes will last, said the doctor. When looking at the findings, however, it is difficult to believe in complete healing. He therefore published an interim report in the diving magazine, Wet Note, to warn active divers. After a COVID infection, even if you have only mild symptoms, you should definitely have a dive doctor examine you thoroughly, even if you still have an upright medical examination. So yeah, they're talking about divers, not Olympic platform divers. I mean, people go under the water with scuba tanks. Having appropriately measured lung function, very important in that case, but other cases as well. And this whole idea that there is permanent lung damage now, we've raised this, we've re-raised it, here it is again. And maybe this isn't for everybody, but certainly for people who are in the so-called mild cases, this is a serious condition. This is why I say, I don't want to get this disease. We're hearing more about permanent or at least long-lasting kidney damage and heart damage as well, possibly testes damage. So this is a real honey badger of a virus. It's really deadly when it gets in there. It's got very sharp claws and can do a lot of damage to people. And so I do worry about this 28-year-old female, no existing health conditions, healthy, in shape, good BMI, all of that, and noticing spots on her lungs. And this is a month into the whole thing. And let's hope she doesn't have what this doctor is seeing in these divers. All right. As a quick aside, a bunch of you sent me this as well. So here's a thing that came out on CNBC today. More deaths, no benefit from malaria drug in VA. Veterans Administration virus study. A malaria drug widely touted by President Donald Trump for treating the new coronavirus showed no benefit in a large analysis of its use in the U.S. So these are the kinds of studies that we want to see. But again, here's something odd. This is the 4th time I found a study like this that said no benefit. And when I go into the PDF and I pull up this search bar right here and I type in the word zinc, I get 0 out of 0 results. 27 pages long. And we know that one of the key things about hydroxychloroquine and chloroquine itself is its zinc ionophore mechanism of action, and that getting zinc inside the cell is an important mechanism of action, and that some of the studies that have reported great benefits have all included zinc as well as azithromycin. Here, all they did was note hydroxychloroquine, and also they compared this against hydroxychloroquine plus or minus azithromycin. No zinc. And you should at least have a discussion in there. Zinc should show up many times in this manuscript, even to say, here's why we didn't use it. Here's why we didn't measure the blood levels of this in the patient so we could correlate potentially their recovery or lack thereof or symptomology against their zinc levels that actually they had in their blood. Why is this important? Because, look, we know zinc plays a role in this. But further than that, we know that the standard American diet, which shortens up to SAD, that SAD diet, has a real shortage of micro and macronutrients in it. Why? Because it's been stripped out during the processing, because we now are growing in soils that are fundamentally depleted of macro and micronutrients. Sure, it's got NPK, that's the nitrogen, the phosphorus, and the potash, but it doesn't have the other things like maybe selenium or zinc or copper or other micros like that. So we know those are important here. And it would be great if at least we could get a study that would run with zinc and, tell us what they find, or at least measure the blood levels, or at least tell us why they didn't. So again, doesn't make sense to me, what's happening here. So I'm not a fan of these particular studies right now. All right. I think it's really best just not to get this virus at all. This is also in that same subreddit of COVID-19 positive. Dad successfully extubated after 24 days on the ventilator. So, hello, I just wanted to give an update that my father was successfully extubated yesterday after 24 days on the ventilator. He's recovering strength now in ICU and breathing on his own with oxygen delivery. His kidneys are still not functioning properly, so he's continuing to receive dialysis. But we're just so happy and thankful he's breathing and on his way to recovery. To everyone out there who's fighting this or has a family member fighting, there is hope no matter how long they are on the vent. We lost hope at times, but there were good days and bad days full of hiccups. But the longer they are intubated, the stronger and more their lungs can recover, and they have a better chance to fight. Do not lose hope, and God bless. So this is a really, really bad virus to get. And of course, the older you are, the worse it is. And if you have underlying comorbidities, those really are additive to the damage that can happen, including all the way up to including death. So the idea is it's just best not to get this. And a place that it's really hard to avoid getting this is in nursing homes. And of course, these have they're just tragic figures coming out. From the small, saying 6 patients dead at a single nursing home, to finding out that nursing homes are ground zero. The Life Care Center in Kirkland, right? It swept through there and just created a nightmare. And we see that COVID-19 has become a nightmare for nursing homes, other senior living facilities, as well as their staffs, their residents, the families involved. Lot of challenges for the nursing homes and their operational model in the UK. Figures showed hundreds of COVID-19 deaths in the UK nursing homes. And so many of these aren't part of the official tally. So remember, the number of deaths might be over-recorded, it might be under-recorded. I think it goes both ways. I don't know which is the larger of the two, but here's a case where they are underreported. Hundreds more people with COVID-19 have died in Britain than have been recorded in the government's daily tally. Official figures showed Tuesday, including a tide of deaths in nursing homes that staff say are being overlooked. So one of the things that we know is that when COVID comes into one of these nursing homes, it just tends to rampage through. And so that's a really bad situation, obviously, and particularly for the patient populations that are in there, and many of them are have mobility issues or other comorbidities that would just predispose them to maybe catching this. And so that's bad. So the biggest decision a lot of people are facing right now is this one. Do I bring mom or dad home? Do I do that? And good article here I found that was talking about this. Your loved one is in a nursing home with COVID-19 cases. What should you do? This is from Tampa, Florida. After the state revealed more than 300 nursing homes and assisted living facilities in Florida have at least one case of COVID inside, anxious family members are eager to take action. It's just a battle back and forth what to do, said Barbara Nemeas. She recently found out the Pinellas County assisted living facility her mom has been staying in for the past few months has more than 55 positive COVID-19 cases. So that's a really, really difficult thing to talk about. So, and a decision to make. What do you do? So to discuss this a little bit further, we're going to turn now to a quick interview I did with Lo Hornbuckle. Let's bring that up now. All right, everyone. So you've just heard me talk about what's going on in nursing homes and institutional care. And at this point of the conversation, we come down to, so what should I do? What do I do with my mom, my dad? And I want to be very actionable about this information, because information without action can just be distressing, and particularly when it comes to this. So I brought on board a friend of mine, Lo Hornbuckle. He is the proprietor of Sage Oak Assisted Living, and he can talk to us about what it means to be in assisted living. In fact, there are options besides just maybe the big sort of institutional assisted and nursing home sort of experience. So Lo, welcome. Good to talk to you again.
Yeah, thank you for having me on the show, and thank you for all the great work you and Adam are doing, keeping everybody safe and informed.
Well, thanks. Yeah. So listen, before I met you, to me, there was just sort of like you live at home and then you go to the nursing home, and there was not a lot of gray area between those two moments, but actually turns out there is. So why don't you talk to us about what your business is before we talk about what's wrong with the institutional care and how what you're offering could actually be a very key point of difference here when it comes to something like COVID.
Sure. And I think that in general, it's very difficult for a lot of people. They think the same way you do. They think you're either at home or in a nursing home, but there's so many things in between. So just take like a brief walk through what's the offerings are in the industry. You have things like independent living, which are more like active adult communities. Maybe you play tennis together, you play golf together, but there's no care provided. So some people think about that as a nursing home, but it's not. Then you also have assisted living, which is where there's no complex medical conditions, but people need a little bit of assistance with their activities of daily living, food, medication, grooming, things like that. Then you have dementia care, which is like assisted living, except it's more catered toward your cognitive needs. So if someone has cognitive impairment, but their physical needs are not necessarily impaired, they could be, but they may not be, then dementia care is appropriate. Then you have kind of skilled nursing and nursing homes. And what our company focuses on is really small boutique settings, because if you think about it, most people can't necessarily afford to stay at home and have 24-hour care, but they also don't want to go to a big institution. And so it offers kind of a middle ground to where you're still doing shared care with other people, but in a much smaller setting. So maybe 8 people, 10 people, 15 people, not 200 or 300 other residents. And so as you might imagine, in a pandemic in which their recommendations are to not have large groups of people, smaller settings really do offer a huge advantage in helping reduce transmission. And we can talk about that in a little bit as actionable steps.
Yeah. So, I was talking with Adam, who was talking with you, and he gave me some key information. And one of them was this idea of person-to-person contact, and just how if you're at a bigger institution, sometimes that's sort of baked in the cake in terms of their support staff and how they function, the processes to have the facility run. So why is it that a larger institution may be more at risk in this particular case?
Yeah, great question. And something we spent a lot of time thinking about. We think our model has a lot of value irrespective of a pandemic, but obviously in a pandemic, the size really does come into play. And the reason why that is imagine this. I think we can all agree that if you run an assisted living facility or a nursing home, the last thing you want is COVID to come to the front door. Would you agree? That seems like a pretty reasonable thing, because once it gets inside, it's so easy to spread. Your population is very vulnerable. The case fatality rates for people that are older and have comorbidities is quite high, probably 15, 20% in a lot of cases. So if you don't want it to come to the front door, the best thing you can do is have the fewest number of people cross your front door threshold, as simple as that sounds. So if you have an 8-bed facility with a staff of 6, it's going to have only 6 opportunities for community spread to come to the front door versus a 200-bed facility with, say, 300 employees. And so one of the number one things is just simple math. The less people from the outside coming in, the less opportunity you have of COVID coming to the front door. So very simple mathematical concept of just reducing the number of chances, because once it gets inside, we all know that spread is very possible. It's a very contagious thing. So like you always say, we don't want Stoffels coming through the front door. No honey badger through the front door is the number one focus.
That's right. Because once it's in, and by the way, the data is just coming out that this is, even if you recover from it, it still could be not quite recovered in a lifelong sort of impairment after that. And so I'm sure a lot of people listening to this are facing a really heart-wrenching decision, which is, mom and dad either are about to go to a facility or they're in one now, and I'm not comfortable with them there. And so the decision to, do I bring them home? What do I do with them? This is weighing on a lot of people's minds right now, I'm sure. So if you were personally facing this decision, how would you go about thinking this through?
Yeah, great question. So the first thing you got to do is consider your individual situation. And the way you would do that is a couple of questions you ask yourself are you equipped personally to take care of mom or dad at home, right? Maybe your house is a 3-story townhouse and mom has mobility issues. Well, that probably wouldn't work. Maybe it's not affordable to have 24-hour care. Typically, most places in the country, 24-hour at-home care is going to run $12,000, $15,000 a month. That's obviously a lot of money for most American families. Whereas shared care might be $4,000 or $5,000 typically for a private bedroom. So the questions you really want to ask yourself, I think, are quite a few. Number one is, how big is the environment? So just like we talked about, how many employees do they have? How many residents do they have? So that's probably one of the most important questions you can ask. Another question that you can ask is, are they going to be able to have a private bedroom or a shared bedroom? Obviously it's very difficult to socially distance when there's someone next to you that might be 3 or 4 feet away and there's just a little thin little curtain between you and them. So having a private bedroom is a strong consideration. Also too, consider the location as it relates to where there's massive community spread. If you're in a city where there's a tremendous amount of community spread, say you're in New York City, could you take mom or dad an hour away, possibly save some money, and then just make the visit on an as-needed basis because there's just less of an endemic problem? I remember when I was growing up, my dad always kind of jokingly told me if he ever needed care, just to send him down to Panama because it was only $2,000 a month and he could live like a king down there. So even then, he was thinking about the future. So we know from families that a lot of people try to keep mom or dad within 15 minutes of where they live. But in a situation where maybe you live in a hot spot, maybe it's better to travel an extra 45 minutes or an hour to go do your visit so you can kind of keep them out of a difficult situation. Another really strong consideration is how good is their medical overlay? So a lot of assisted living facilities don't have to have a nurse. So they might just have caregivers or nurse aides. Do they have a medical director? That's obviously going to help a lot because one of the biggest challenges in our environment is our staff gets trained on infection control, but they don't get trained on the same level as someone that works in a hospital environment. The other thing too is that, we see all this stuff day in and day out. Doctors and nurses are heroes. Doctors and nurses are heroes. And that's really important conversation. But the forgotten people in all this are the nurse aides and the caregivers and people that are doing all the same things that put them at risk of transmission that a nurse or a doctor does. But assisted living facilities and nursing homes, we're kind of second tier in terms of getting personal protective equipment. So when you see these states allocate resources, they're not really thinking about assisted living and nursing home as much as they should, because the best thing we can do is prevent it from going to the hospital. And so there's a whole zeitgeist out there where really people aren't thinking about our environment in the best way possible. The other thing to really think about is what is their ratio of direct care staff to residents? I think you want to target something between 1 to 4 and 1 to 6. You get up to 1 to 10, 1 to 12, 1 to 15. If you were to have a situation where you needed to isolate somebody, that's almost impossible because if that caregiver is responsible for 10 people or 12 people or 15 people, how could you possibly, take care of someone that needs to be isolated? Especially in a situation like where you have dementia potentially, someone may be prone to wandering. You need all the resources you can to try to control a situation like that. The other thing I would really strongly encourage people to think about is technology. So there's 2 things you really have to understand about technology. Number one, social isolation is a really, really bad for everybody, but it's especially bad for the elderly. We think about all these horror stories. Someone's locked in their room. They're sad. They're depressed. They're not eating. That can be just as deadly as a pandemic. And so using technology so you can call the family, on FaceTime. Do they have the type of facility where you can literally, wheel mom or dad in their wheelchair up to the window and we can do a window visit, things like that where we're distanced social, maybe physically, but we still have those social connections. And the other big thing is telemedicine. So, do you have a doctor and do you have a setup to where essentially the facility can allow a doctor to do some diagnosis, can do some medical review via technology, right? So, our physician very early on said, listen, I'm not going to come into the facility unless I absolutely have to, because there's no reason for me to be that extra set of possible transmission. So we're going to set up telehealth portals to facilitate, hey, if there's a skin tear, I can take a look at it. If I need to physically view the resident, we can do so with video and technology. So modern technology is really important. Assisted living and senior housing, you might guess, is not real strong on embracing technology. It's because, they're dealing with a lot of 85-year-olds and caregivers that may not use as much technology. So having a facility that understands how to use technology can really be a huge boon in a situation like this, because you solve social isolation and you can make sure that you still have access to medical care, even if the doctor doesn't have to physically come. And so that makes a big difference in a situation like this.
Yeah, Lo, how many facilities are you running right now?
So we have 5 locations in Dallas, and then we have several that are being built right now in Texas and Louisiana. So all told, we have about 300 beds under various stages of development.
And when you first heard about COVID and it sort of dawned into your awareness, like, oh my gosh, I got to do something about this, what did you do?
So the first thing I did was, selfishly, the mistake I made was I was thinking about it in terms of myself. So I was thinking about, like, how do I get prepared myself? And then when the data started coming out and I started realizing, oh my gosh, this is going to be a really big deal for, the people that I'm in charge of taking care of. We did a few things. Number one is we shored up our supply chain in a couple of ways. So we ordered personal protective equipment way sooner than a lot of other people. And that's a credit to you and your team putting out a warning and me having the sense to follow your advice. So we were able to get masks, gloves, hand sanitizer when everyone else was still unaware that this was a big deal. The other thing we did is we sort of followed the Prosper guidelines. We have about 30 days of food at an offsite location so that we can kind of have control. So if there's a supply chain disruption, and we've had some of those, some days when there's no eggs, some days there's no milk, some days there's no bread. We shop at Walmart and Sam's Club like any other, consumer. And, so we have an extra supply of food. So if we have any problems, we could do that. We also were very early to limit visitation. So we were about a week ahead of medical guidelines, in which the medical guidelines wanted us to take temperature of people that were coming into the facilities. But we all know this thing spreads asymptomatically. So for about a week, we were really kind of pariahs, because we told families we really want to stop visitation completely, ban all non-medically essential personnel. And if you might imagine, if you're a home health or a hospice provider and you get your compensation by service visits, we were not too popular for that. And I think ultimately history will judge us favorably for taking those steps. And of course, now the things that we're doing are in fact codified by law. So both Dallas and Texas and federally, there are guidelines that basically say no non-medically essential visitation. We took those steps a little early. What I basically said was, the moment I feel like there's substantial community spread in Dallas, we were going to make that announcement. So we kind of had a plan in place, and then we executed that plan whenever we had that information coming in from the public health authorities.
Yeah, so you had your bright red line, and my projection on this whole thing is that because you're smart and you're paying attention, and it's also you're smaller in scale, you can operate more quickly, and you got to be nimble with this honey badger virus. Right? You got to be fast, and it's going to outpace, like, big bureaucracies, and I get that. Must be ridiculously hard to run a 500 bed facility or something like that with all those people and SOPs and just figuring out how you would retrain people. I mean, whatever the story is, right? There's just going to be a 1,000 things you have to do, and that size makes it just harder to react in a case like this, I would imagine.
Yeah, absolutely. And one of the biggest things we've done is we implemented a policy where we told our management team, I want every single family member contacted once a week, because they can't visit. So we want proactive communication. It's very difficult to do that in a big setting. We are part of our culture. We actually include in our company motto, great care, great food, and great communication. And that's part of our company motto. And the reason is because if you interact with healthcare, communication is really at a premium in healthcare. There's really not a lot of great communication from the medical industry. And so we feel like if mom's having a good day, we take a photo, send it to you, you're going to be happy. If we can jump on a FaceTime, if we can update you, if you hear about a problem from us and not from mom or not from the caregiver or not from, maybe another family member, then you're going to think we're on top of things. So really, really strong proactive communication, because this is really hard on the resident. It's really hard on the staff. It's really hard on the families, because, some people visit their mom or dad every day. And now all of a sudden, the best they can do is get on the other side of a piece of glass and talk on a cell phone with them. And, a lot of our clients do have dementia. And so, operating a cell phone or sort of understanding what's going on, it's a very confusing time for them on top of their normal confusion. So, it's a very difficult situation. The best thing we can do is communicate really well. And so we're constantly putting out letters and updates. Another thing I think you'd really appreciate is whenever you and Adam put together the supply chain concern about the Indian pharmaceuticals, we put that notice out to our families and said, hey, it might be a good idea to get 90 days of medication, store it, gave them some practical advice on how to do that. And then about a week later, the Food and Drug Administration said the same thing. Mm-hmm. And a lot of my families were like, how did you beat the FDA on this thing? And I was like, I know people. So it was great to do that. And I think it gave us a lot of credibility, because as we started doing these things that were a little ahead of the curve, a little faster than what the officials recommended, the families were like, well, you were right about the drug things. Maybe we're going to trust you on the visitation. We're going to trust you on the mask. We're going to trust you on these other things.
Yeah. Well, thank you very much for that. And I just wanted to leave people with the idea that, if I'm not faced with this, but if my mother was in a nursing home, I would be very, very concerned, and I'd be considering pulling her out to residential assisted living if it was appropriate, right? Given, sure, what the facility can offer and what her particular needs were. But I think a lot of people do fit into that. And so that's actually something that's worth considering at this point, because when COVID gets into one of these big nursing homes, it just rampages through there with just sometimes some very awful results. So thank you so much for your time today. And if people wanted to find out more about this residential assisted living, it was news to me when I found out about it. Where would they go? What would be a good resource?
Yeah, so we got the team to work on a little special offering for your guests. It's very simple. We have a book that we put together that just kind of talks about residential assisted living. So we can send that to them in a PDF format. It's totally free. It's just going to help them kind of make some decisions on that front. So they can go to Good Horn Capital, GOOD, Horn, HORN, capital.com. And there'll be an opportunity for them to request a copy of our book called The Sage Oak Story. And that'll give them a PDF version of some of the ideas and concepts that we brought in from residential assisted living. They can get a hold of me there. And listen, if they're, obviously there's people in Dallas we can service, but if there's somebody in Kentucky that just has a question, they can email me, call me, and we'll help them sort it out, because, we're connected to the mission, and the mission is to improve care for people all over the country.
Excellent. Well, thank you so much.
Hey, thank you.
All right. Some really good information there. I hope you found that useful. It was a big eye opener for me to find out about assisted living and to think about it and talk about what it can and can't do and all of that other stuff. But it is another good option, I think, potentially for mom and dad, if that applies to you. So here's that website that Lo just mentioned, Good Horn Capital. And goodhorncapital.com will bring you up to this, and you can get a free copy of all the decisions around that. And he said, feel free to post his email. So there it is, Lo at thesageoak.com. All right. Thanks, Lo, for that. Oil again. Remember yesterday, if you tuned in yesterday, you saw this ridiculous situation where oil went to minus $40+ a barrel. That was yesterday. And that was a futures contract, and that was the May futures contract. So all attention now is turned to the June futures contract, which was trading at about $20, $21 when I woke up this morning. Craig at TF Metals Report wrote here, yesterday was all about the May 20th NYMEX crude contract. With the liquidations of the June 20 crude today, you must begin to consider the impact of this contract very possibly heading towards zero as well. This is becoming a very serious and dangerous situation for all global markets. Look at this. Oh, my God. What do we do with something like that? You make a joke out of it, I guess. I don't know. If you're familiar with this little meme here from The Simpsons, you'll laugh. If you're not, go look it up. It's good stuff. So when the May oil contract trades for minus $2.42 a barrel, and then the next day the June contract plummets by 37%, I'm in danger, right? This is a really dangerous situation. And this could totally upend markets. This is going to absolutely destroy the shale industry. It's going to destroy a lot of the finances of some of the major oil companies. They're going to have to borrow a lot more money. They were already up to their eyeballs in new debt because turned out even oil at 50 and 60 wasn't enough for them to explore and run their operations and pay dividends to their shareholders. So what did they do? They borrowed money to be able to pay dividends typically. And so a lot of debt on the books, and now an absolutely unacceptable condition. And why don't we just shut down the wells? Why don't we just shut in some oil production? It's not that easy. Oil production can easily, if you shut it in, can easily damage a reservoir. It's very tricky, all of that. But I want to talk about how this is really a self-inflicted oily wound of the shale industry. Look at this giant drop in rigs. People are talking about that. These are rotary rigs. These are the big giant rigs that you see out there that would drill 10, 20,000 feet down into the ground to get at the shale oil and all of that other stuff. And look how much has dropped. Or we could look at the fact that there are still 520 of these operating. Who is operating these things still, right? This was way too many. It led to way too much oil being produced. That is a self-inflicted wound. And you could say, look at that huge drop. And I would say that's still too many. You know what that number ought to be right now? 0. If we were being smart about it. I realize there's lots of other reasons. They have to hold the leases, or they might lose them, drill it or lose it kind of stuff. All right, there's all kinds of decisions, but individually, but collectively, there's no reason to have 500 plus of these things operating right now. So this smacking that's happening in the oil industry is going to have reverberations that are going to be felt for years, and it's going to be very hard to recover from that. Remember, I'm going to ask you to resubscribe to this channel if necessary. People report being unsubscribed all the time. Thank you, YouTube. Very helpful of you doing that. And as well, that happens at Twitter as well. So people get unsubscribed all the time. Remember, plan a garden. And the reason I say plan a garden around these things is because of maybe the immigration issue, or even the migrant workers aren't coming in. More and more reports coming in that fields are not being planted, and even if they are planted, maybe they won't have anybody there to harvest them. So I think there could be a real shortage of fruits and vegetables. I think our base calories are going to be fine, but the real tasty stuff that you need to be healthy so that you have those macro and micronutrients, and by the way, you can control those in your own garden better than if you even buy organic, which is no guarantee. That's a practice of gardening and farming. It's not actually a guarantee that that food has any more nutritional quality to it necessarily from a macro micronutrient basis. Your best bet is to plant a garden or hook up and find a local CSA where you have a local farmer, maybe a bright, shiny young couple, and what they do is they farm their soil first and provide vegetables to you second, which is going to be a much better way to get your fruits and vegetables. All right. Even these mild cases can be really, really damaging and could lead to lifelong conditions. Let me just make this just a little bigger, make it easier to see. That's a big problem. This is really starting to be very concerning. This lifelong damage, the lung damage, the kidney damage, stuff like that. But even if you have a mild case, that can leave you, and it leaves many people facing a 5 or a 6 week battle. They describe it as being run over by a truck or a bus or a tank. Being able to walk up a set of stairs and then collapse for a 2-hour nap, things like that. These mild cases can still be very debilitating. I am still continuing to read study after study exploring hydroxychloroquine, but they aren't including zinc. All right. They're not even measuring it in serum levels or in any way tracing it or even discussing it. And I find that weird, very weird. You ought to at least say, we didn't think it was worth trying, blah, right? Okay, you've at least thrown it up out, you've put that up front, but otherwise just being totally silent about it. I'm like, why? What is going on here? Strange. Nursing homes, I think they're a recipe for COVID disaster. Obviously, that's being borne out. Any place where you have a at-risk population clustered and you have lots and lots of patient and person-to-person contact points. We have many people coming through that front door. As Lowe Hornbuckle told us, that's the first thing they did was try and limit the number of people coming through the door. And that's the first thing that makes sense. It makes as much sense as wearing a mask, right? And so that's just in the design of nursing homes and all of that. It's just how they're structured. And residential assisted living could be a great fit for many. And so I just wanted to raise that. If any of you are struggling with that, here's something you could explore. And of course, when you take action, that's what relieves any anxiety you might be feeling, because anxiety lives in the gap between what you already know to be true and the actions you aren't taking. That's where the anxiety lives. Since you can't unknow what you know, how do you close that gap? Well, you take new actions. So with that, take the actions you need to take to protect your mom, your dad, yourself, your loved ones, all of that. Plant a garden. Get ready for a very different future that's coming along. And that's all I have to say about that today. Remember, it didn't have to be this way. We could have done this very differently. So we'll do it. We'll get it done. We'll get there. Take care. We'll talk to you tomorrow. Goodbye.
Hi, folks. Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.